Hello, my name is Tucker Shoop, and I am a second year pharmacy student.
And I'm Caitlin Panzik. I am in my second year of the Family Nurse Practitioner program.
And together we're going to be presenting a case on MS. She's a 72-year-old Caucasian female with a family history significant for cardiovascular disease. She's been on medication to help control her blood pressure for over 30 years. Her past history includes smoking on and off for most of her adult life, but she's remained smoke-free since having a rib biopsy back in 2002. Her blood pressure has been controlled on numerous medications, including a diuretic, an ACE inhibitor, and a calcium channel blocker for years, until she woke up one morning experiencing angioedema in her tongue and in her lips. She immediately called her doctor, who told her to discontinue her lisinopril, but continue taking her other medications. So currently MS is being controlling her blood pressure using a 2-drug combination of hydrochlorothiazide, 25 milligrams PO daily, and amlodipine, 10 milligrams PO daily.
Her past medical history includes hypertension, hypothyroidism, hyperlipidemia, arthritis, obesity, and a history of shingles in 1971. She has also had past surgical history, which includes a rib biopsy, which was done in 2002 and was benign, a tubal ligation done in 1972, a placental separation and emergent C-section in 1969, and a tonsil and adenoid removal as a child.
Her family history includes a father, her mother, and one brother who all passed away from a heart attack. Her husband died back in 2001 after he suffered a stroke. She has one brother who's still alive, although he's had a long past of medical history that includes hypertension, diabetes, hyperlipidemia, cataract surgery, aneurysm coiling. He's had bilateral knee replacements, and he's had a thyroidectomy. She and her husband had 5 children together. One daughter passed away from toxic shock syndrome at the age of 25, but the other children are alive and healthy, and she has a large number of grandchildren and great-grandchildren.
Her social history: she was born and raised in central Massachusetts. She retired at the age of 65. She lives alone in an elderly community. However, she's still quite active as she babysits 2 of her great-grandchildren 2 to 3 days a week. She denies routine regular exercise, but states that during the summer months, she's more active and attempts to walk each day. She actively watches her salt intake and tries to avoid frozen meals. She never eats canned fruits or vegetables and finds it difficult to cook a healthy meal for each night for just herself. She was a previous smoker on and off for approximately 30 years, but hasn't smoked since 2002 after having a rib biopsy. She denies drinking alcohol and denies any history of substance use or illegal drug use.
MS has a few allergies. She's, like we mentioned before, she had angioedema from taking an ACE inhibitor, and she's also experienced a small rash from taking amoxicillin. She's on quite a few medications. She's taking Synthroid, 150 micrograms for thyroid. She takes amlodipine, 10 milligram, and hydrochlorothiazide, 25 milligrams. She takes those daily for hypertension. She takes gabapentin, 100 milligrams, 3 times a day for some leg pain. Lipitor, 20 milligrams daily for lipids. She takes a daily multivitamin as long as 2,000 international units of vitamin D. She takes aspirin, 325 milligrams daily for her heart. And then she's also taking a tablet of glucosamine and chondroitin daily for some arthritis.
During MS's brief physical exam, she was noticed to be very well kept, interactive, and responded appropriately. She was 5 feet 6 inches tall and 290 pounds, which gave her a BMI of 46.8. Her vital signs at the time of the physical exam were her blood pressure was 134/72, her temperature was 98.4, her respiratory rate was 18, and her pulse was 88 beats per minute. Her O2 sat was 97%, and all of these values were noted to be within normal range. We were happy with these. Generally, she was alert and oriented times 3. Her head, ears, eyes, nose, and throat were within normal limits. She had no nodules or goiters, and there were no bruits or other pulses. All pulses were palpable and equal throughout. Her abdomen was soft and non-tender, and there was a +1 trace edema in both lower extremities. There was slight generalized weakness, and her skin was warm, dry, and intact.
All right, as we interviewed MS, we noticed she did have a few complaints. Of course, she complained of the swelling in her legs, like we noted. She also complained of having to wake up frequently in the or at night and use the bathroom, probably from her diuretic. And then she also complained of joint pain from her arthritis. Specifically on her edema is something that I thought from a pharmacy standpoint interested me, and I really wanted to look at. Like we said, she has been on numerous antihypertensives and has been on that for years due to her family history of cardiovascular disease. But like we said, she did have that severe reaction that we trace back to lisinopril. And so she's currently been just on a 2-drug regimen of the amlodipine and the hydrochlorothiazide, which have been controlling her blood pressure, but she has been seeing the edema. Looking into that further, one of the known side effects of calcium channel blockers is peripheral edema. ACE inhibitors and angiotensin receptor blockers have been shown to reduce the incidence of peripheral edema that is caused by calcium channel blockers. And ACE inhibitors are, of course, the most efficacious, but due to her side effect, that's not really an option for us. But the ARBs have been shown to reduce the peripheral edema, and so that would be an appropriate recommendation that we could make for her. Of course, we still want to keep her blood pressure goal according to the JNC guidelines with her age of under 150/90. We'd want to minimize the effects from those calcium channel blockers, the edema. We, of course, would want to increase her quality of life, which we could as long as we could relieve that edema and minimize any further drug-drug interactions. So what we'd recommend is to continue her on her amlodipine 10 milligram and also her diuretic, her hydrochlorothiazide 25 milligrams, to continue that, taking those daily, but to also add on an angiotensin receptor blocker such as losartan 50 milligrams if she took that daily, and that could help control some of that, the major side effect that she was feeling because of that calcium channel blocker.
So from a nursing standpoint, I would counsel MS on maintaining a healthy diet, to continue to watch her sodium intake, and to also see a nutritionist so that she can be counseled on how to cook for herself, since she does live by herself. And she does complain that it's a little difficult to cook for just one person each night. In addition, I would like to see her start to exercise regularly, perhaps a 30-minute routine every day in order to bring her BMI down. Finally, I would suggest wearing TED stockings to help reduce the swelling and to bring the circulation back up to the heart.
All right, in conclusion, as we've been able to meet with MS and discuss her profile, we feel like we've collaborated pretty well to recommend a few things that would help her, especially with some of the symptoms that she's been feeling with the medication change, with a few lifestyle changes, some of the things that she should watch out for. We feel like we could definitely help her enjoy a better quality of life and not have to live through some of these adverse side effects that she is currently experiencing. One thing that we would like her to do is, or encourage her to do is, as she starts this new medication, we of course would want her to follow up with her doctor to make sure everything is going okay. We'd counsel her to watch for signs and symptoms of hypotension as she's starting a new medication. We want that range to be where in goal and where it should be, and even if she's feeling better, we'd counsel her to continue to take her medications. So it's been a joy dealing with this case, and we hope that it works out. So thank you.
Thanks.